looking for genes is like a little needle in a haystack. So you actually get samples from the family members that have the mutations, and the lab will build a probe looking for the specific mutation that this family has in the DNA of the embryo. It is amazing what science can do, and it's absolutely incredible. But big picture is you got to test beforehand, and not everybody has to do this. And so talk to your doctor about carrier screening to see if it's right for you. Welcome to Baby or Bust. I'm your host, Dr. Lora Shahine, and I am tired of infertility and miscarriage being misunderstood, hidden, and full of stigma. Welcome to the podcast with interviews and in-depth discussions on topics, all things reproductive health. Thank you to our friends at Seattle Sperm Bank and Braze Run Production for sponsoring the show. Please take a moment to give us a 5-star review anywhere you listen to your podcast. It really helps people find the show. Genetic screening of embryos is an incredible technology that I have personally witnessed revolutionize the IVF process for many patients. But it can be incredibly confusing for patients trying to navigate an already complicated pathway to parenthood. In this in-depth review, I explain exactly what we're testing for, how it works, who benefits from it, and what questions you should ask your doctor. Not everyone needs to do genetic screening of embryos, and understanding more about its use for your personal situation is key to your overall success. Let's get started. When we talk about genetic screening of embryos, genetic testing of embryos, so many of my patients can get really confused about what options are available and exactly what we're testing on embryos. If you're feeling that way, you are not alone, and I want you to understand. The healthcare providers, doctors, nurses can throw around all these different acronyms: PGT, PGT-A, CS, CCS, all these different things. You can hear the words pre-implantation genetic testing, pre-implantation genetic screening, pre-implantation single gene testing. Like, everybody was using all these different terms. And finally, the American Society of Reproductive Medicine said, whoa, we all got to use the same terms. And so they came out with 3 basic terms. So the 3 different types, they all start with pre-implantation genetic testing, or PGT. And then they end with different things: PGT-A for aneuploidy, PGT-M for monogenic or single gene disorder testing, and then PGT-SR, which is structural rearrangements of chromosomes. I'm going to help you understand what this is. A little bit more of an overview. So not everybody does genetic testing on their embryos, but you have the option to do so. And it's important to talk to your doctor about what's right for you before you even get started with your IVF cycle. So a little bit of a recap about IVF. You take medications, gonadotropins, to stimulate the ovaries to make multiple eggs. We do an egg retrieval to get the eggs out of the body, got the eggs in the lab. We get sperm. We help the eggs and sperm fertilize, and then we watch those embryos grow. And when the embryos are about 5 or 6 days old, they're about 100 to 120 cells. They're called blastocysts. These are mature embryos, and we can actually freeze the embryos at this time. And before we freeze them, we can biopsy some of the cells away. So if the embryo is about 100 cells, we're actually taking away 5 to 10 cells to test. We freeze the embryos. The embryos don't leave the embryology lab. They stay. It's just the cells that get sent to test. And at the lab that tests them, the lab needs to know exactly what you want them to test for. And so this pre-implantation genetic testing is testing the embryos, biopsying the embryos, and then freezing them and waiting until you know what you have in the embryo before you do the transfer. Before the embryo implants, you know if it's got a structural rearrangement or a single gene disorder, or et cetera. And so that's where that pre-implantation genetic testing term comes from. You can only test embryos if you do IVF. You have to get the eggs and sperm out of the body and test the embryos out of the body, and then you can do an embryo transfer. So the first one we'll talk about is PGT-M. That stands for pre-implantation genetic testing for monogenic or single gene disorder. So PGT-M is the process of testing cells of an embryo for a single gene disorder. And so this could be genes that lead to disease like cystic fibrosis, sickle cell disease, Tay-Sachs disease, muscular dystrophy. So some people know that they carry genetic disorders in their family. Maybe they have a child with cystic fibrosis, and that's how they found out that they carry that mutation. Or they have a mutation themselves for something like Huntington's disease, which is a neurologic disease that really only manifests later in life, but it's something that you're born with. It's a genetic disease that you're born with. So if you know that you have the risk of having a child with this genetic disease, you can actually test embryos beforehand and decrease the risk of passing this gene on. Now, the trick is for this type of testing, you have to know what you're looking for. It's actually pretty hard to find little tiny mutations. It's like a needle in a haystack with all this genetic material that comes from the cells of the embryo. And you need to know beforehand. So the people who are getting pregnant, the person with the eggs and the person with the sperm, needs to do what's called carrier screening before they do IVF to know if there's anything to look for. I've had patients say, well, yeah, you've got my embryos anyway. Why don't you just test for all those different diseases when you've got them out of my body anyway? Well, it just doesn't work that way. We just don't get enough DNA. You can actually test for hundreds and hundreds of different mutations, but the technology requires that you need to know what you're looking for. So I talk to my patients, not everybody does it, but I talk to my patients about doing carrier screening before they get pregnant or before they do an IVF cycle to see if they're at risk. Because someone can actually carry a mutation for cystic fibrosis and not have it and have nobody in their family have it. And if they happen to marry someone else with that exact same mutation, then they have a 25% risk of having a child with cystic fibrosis. So you can carry a gene, like a mutation in a gene that leads to disease, but a lot of diseases, you have to carry two mutations, one inherited from the egg, one inherited from the sperm in order to have that disease in the child. So the reason that this is so rare is that there's hundreds of mutations for cystic fibrosis, and it really is very rare for someone to find somebody else with that exact same mutation, but it can happen. And I do have people coming to my practice who had a child with a genetic disease, and that's how they found out that they carried this mutation. And they're actually coming to do IVF, not because they're having difficulty getting pregnant, but they're doing it in order to screen those embryos to decrease the risk of having another child that's affected. Because there are some genetic diseases that really result in significant hardship and even neonatal death, like really soon. I know it's hard to talk about, but it's amazing what technology can do and what options are open to you. Now, if you find out that you carry the same mutation, it doesn't mean that you absolutely have to test your embryos for it. Not every embryo will be affected. And some people are like, well, I think it's okay if we inherit that particular thing. Something like I've had patients with polycystic kidney disease. That's a genetic disease that you inherit from both of your egg and sperm, and it can affect the kidneys can be enlarged and have a little bit of kidney dysfunction, have cysts in their kidneys, but they can live full, happy, great lives. And so sometimes people can find out that they carry mutations. It doesn't mean that you necessarily have to test your embryos. It's really a personal decision, but it's really good to be able to have that discussion and choice and know whether that's right for you or not. And so it's really important before you do IVF, and you could even consider doing carrier screening before you even start trying to conceive, just to make sure that you know whether or not you carry something. And again, big points is you can't test each embryo for the hundreds of different mutations that are out there. You have to know exactly what you're looking for. And it actually takes time for the IVF clinic to ask the lab to build a probe, because again, looking for genes is like a little needle in a haystack. So you actually get samples from the family members that have the mutations, and the lab will build a probe looking for the specific mutation that this family has in the DNA of the embryo. It is amazing what science can do, and it's absolutely incredible. But big picture is you got to test beforehand. It takes a while to build that probe if you do decide to have your embryos tested for it. And not everybody has to do this. And so talk to your doctor about carrier screening to see if it's right for you. The next one is PGT-SR, and this is pre-implantation genetic testing for structural rearrangement. And just like testing for single gene disorders, PGT-M, with PGT-SR, you have to know what you're looking for before you actually do that testing on the embryos. So in this case, it's not a single gene disorder that can cause a disease. It's if the person with the eggs or person with the sperm has something called a balanced translocation in their own chromosomes, then you can look for that in embryos. Let me explain. I know it's confusing. A balanced translocation is something that's very rare, but it's something that we look for if a couple is having recurrent pregnancy loss or recurrent miscarriages, because the most common cause of miscarriage is a chromosome imbalance or genetic rearrangement in the embryo that is not compatible with live birth. And people who are getting pregnant that have a balanced translocation, a lot of their gametes, whether it's eggs or sperm, will have structural chromosomal rearrangements, and they will have a higher chance of miscarriage as a couple if one of the people carries a balanced translocation. So the way this is discovered is not everybody gets this testing. The way you figure out if you have a balanced translocation is you do a blood test, and people who you think about doing this test on are typically people who have had 2 or more miscarriages. That's the definition of recurrent miscarriage. It's a standard evaluation for somebody with recurrent miscarriage, just like a uterine cavity evaluation or checking thyroid levels. I have written a whole book on recurrent miscarriage. I just really want people to understand there's so many misunderstandings, confusion around recurrent miscarriage. So if you really want to learn more about that, I encourage you to read my book, Not Broken. You can find it on Amazon, but I've got a whole chapter on evaluation of recurrent miscarriage, and I talk a lot about balanced translocation. So if you have a balanced translocation, it does not mean that you are affected. So the most common time that I'm talking about balanced translocation, I'm actually counseling a couple that is having miscarriages together. And there's usually so many tests that the person with a uterus, the women have to do, anatomy testing and blood work and all this kind of stuff. For the person with sperm, the male partner, I usually do a semen analysis. And then the one blood test I insist on is a balanced translocation. So when I'm counseling patients, I'm usually like, hey, listen, I'm going to talk about the guy. If you have a balanced translocation, what that means is when the egg and sperm came together to make you, yes, I know you have to think about your parents. But anyway, when the egg and sperm came together to make you, all those chromosomes line up together and then they split apart. And remember biology class, those X's and those chromosomes. So when the egg and sperm come together, all those chromosomes line up and then they split apart. And if there's a mistake in the lineup and there's an exchange of material between 2 chromosomes, it could be a piece of chromosome number 8 ends up on chromosome number 11, and that portion of number 11 ends up on number 8. It's a balanced translocation. So that genetic information is on the wrong chromosome, but when that exchange happened, there was no loss of material. So if you have a balanced translocation, if that male partner has a balanced translocation, he's not missing any genetic material in the cells in his body, that all the chromosome has that. But when he goes to make sperm, when you make sperm, the chromosome material lines up and splits apart. Some of the sperm is going to have total normal chromosome content, and some of the sperm is going to be missing big portions of chromosomes. And that is why he is more likely to have miscarriages, or a couple with one of the partners who has a balanced translocation, they're going to have more miscarriages because a lot of the gametes, whether it's sperm or eggs, are going to be missing material. Now, people with balanced translocation don't always have miscarriages. The most common presentation is a live birth intermixed with a lot of miscarriages, like more miscarriages than you would expect for a couple, whatever age they are. But some of the sperm is going to be just fine. It's just that if you find this, then you know why you're having more miscarriages than you would expect. And you can talk to your doctor about the option of screening embryos for that structural rearrangement. All this stuff is not black and white. It's just important to realize what we're looking for and what you can do. So again, the most common time that this comes up for me is I'm counseling a patient with recurrent miscarriages. We do the evaluation and it comes back that they have a balanced translocation. And I say, hey, this is what you have. I go through that whole explanation. And then I say, one option for you is to keep trying. The next time you get pregnant, it could be a perfectly normal embryo and they have a baby, but you are at a higher risk of having another miscarriage. And so one option for you would be to do IVF and test those embryos for chromosome content. So when you transfer an embryo, it doesn't have a chromosome structural rearrangement. You have a lower chance of miscarriage. Okay. So that's another thing that you have to know beforehand before you can test the embryos, just like the PGT-M, where you're looking for a monogenic or a single gene disorder. Are you with me? I know it's a lot. Okay. And the third type of genetic testing. Now, this is the most common pre-implantation genetic testing for aneuploidy. This is what most people do if they do genetic testing on embryos for IVF. That's why I save the best for last. So this is, again, biopsying the embryo before you freeze it and knowing more about the genetic content of the embryo before you transfer it. What you do with those cells in the specialty lab is they're testing for all the chromosomes. So every time an egg and sperm come together, they give half of the genetic material and it's in the form of chromosomes. So half of the chromosomes come from the egg and half of the chromosomes come from the sperm. And when they come together, they all line up. If it's balanced chromosome content, you have a very high chance of live birth. If it's imbalanced, then you have a high chance of the embryo not implanting, so getting a negative pregnancy test, or miscarriage, because the most common cause of miscarriage is a chromosome rearrangement in that embryo. And what is different about the other types of genetic testing on these embryos is every time an egg and sperm come together, it has the chance of doing it right or the chance of doing it wrong. So if an egg hangs on to a number 7 chromosome, then the egg is going to be giving 2 copies and the sperm is going to give a copy. And that is too many copies. That's triploidy. And that embryo is not going to be successful. If the either the egg or sperm isn't giving enough genetic material, if you're missing a chromosome and you only have one chromosome, number 2, that is monosomy. And that embryo, it can look beautiful under the microscope, but when you transfer it, it is not going to be successful. And each embryo is unique. Now, you don't have to do any pre-testing on the person with the eggs or the person with the sperm in order to do this type of genetic testing, because each time an egg and sperm come together, it's a possibility of doing it right or doing it wrong. So this is not something that you screen for in the people that are getting pregnant and then look for later. This is testing each individual embryo and seeing what happens. Now, whether you do chromosomal screening or not, for aneuploidy means incorrect chromosome content, unbalanced chromosome content. Whether you do that or not is really personal. So I talk to my patients about it being optional, but in general, common patients that I have that choose and opt to do genetic testing on their embryos are patients that have had multiple miscarriages because it can decrease the risk of miscarriage. Patients that are starting their family or adding to their family later in life as eggs and sperm age, they make more and more chromosome problems or issues when they're coming together and fertilizing. So advanced reproductive age is a common indication for doing aneuploidy screening on embryos. If people are doing embryo creation for fertility preservation, they're not going to use these embryos for a few years for whatever reason. It makes a lot of sense to really know what you have frozen, because again, not every embryo is going to be a baby. And I think of this pre-implantation genetic testing for aneuploidy as an embryo selection tool, finding embryos that have the highest chance of implantation, the lowest risk of miscarriage. And it has done wonders in the field for decreasing the risk of twins, triplets, and high risk multiple gestation pregnancies. Before we were doing chromosomal screening on embryos as much as we do now, it was routine to transfer 5 or 6 untested embryos in someone that was 40. And we were so happy if someone got pregnant, because we know that as eggs and sperm age, not all of them are perfect. And then if somebody got twins, we were like, sorry, or triplets, oh my God, the high risk pregnancy. Now we can screen these embryos and have a very high success rate with transferring one embryo at any age. It's really amazing. So I know that's a lot of information, but it is really important for you to understand the 3 different types of genetic screening on your embryos and know what to ask your doctor about them. So let's recap. I know that is a lot of information, but it is really important to get this stuff before you go through IVF and you're trying to decide sort of last minute. So let's go over the 3 different types of pre-implantation genetic testing of your embryos. Number 1, PGT-M, pre-implantation genetic testing for monogenic or single gene disorders. So these are mutations that the parents can carry, and you're trying to test for them in the embryo to decrease the risk of genetic diseases like cystic fibrosis, sickle cell disease, Tay-Sachs disease, etc. The second is PGT-SR, pre-implantation genetic testing for structural rearrangement. And this is looking for issues within the embryo that could be passed from a parent that has a balanced translocation on to that embryo. So you're trying to select for embryos that have normal chromosome content and not this structural rearrangement, but you're looking for something specific. And finally, the most common one, PGT-A, or pre-implantation genetic testing for aneuploidy. And this is not something that people pass on to their embryos. This is something that is unique to each embryo. Every time an egg sperm come together, it has the opportunity of doing that chromosome lineup correctly or incorrectly, and you're trying to select for embryos that have a balanced chromosome content, because those are the ones that have the highest chance of success when you transfer them. The fertility story for this episode is about one of the lesser common reasons people do genetic screening of embryos. And specifically, it's for looking for a balanced translocation in the people that are having recurrent pregnancy loss. And if we find that in a couple, then we can test embryos for chromosome rearrangements that are causing miscarriage. And whenever I'm counseling patients about getting this testing done or using this as a part of their IVF process, I think about this couple. So this young couple saw me for a 4th or even 5th medical opinion. They had 1 daughter together, but they had also suffered 10 total miscarriages, some before having their daughter and some while trying to add to their family. I went through their history and records, lots and lots of records, and they assured me that they had done all the tests for recurrent pregnancy loss, and that every doctor they talked to said there was no explanation, not sure why this was happening for this couple. They came to me asking to do IVF in order to do the genetic screening of embryos for chromosomes in each embryo in order to decrease the risk of miscarriage. So they feel like they had tried kind of without intervention. They keep having miscarriages, and they know that for some people, if they can screen embryos for chromosome rearrangements and transfer an embryo that's been screened, they will have a lower chance of miscarriage. And so that's what we spent most of our time talking about. But I said, I really do want to go through your records with a fine-tooth comb and make sure that we've tested everything before we get started with IVF. And I said, the one thing that I really can't find is a karyotype in either of you. So that's testing both the person with the eggs and the person with the sperm to see if their chromosomes are aligned or if they're rearranged. So there are healthy reproductive people out there that have a balanced translocation, meaning that some of the information that's on chromosome 11 is over on number 18 or vice versa. And they're fine. They've got all their genetic code. There was no information lost when the eggs and sperm came together. But when that person with a balanced translocation goes to try to have a baby, their gametes, whether they're eggs and sperm, Some of them are going to have all the correct information, but a lot of them are going to be missing genetic information. So someone with a balanced translocation will have a much higher chance of miscarriage. Now, not all of their gametes will be impacted. So sometimes a couple can have a baby or even 2 babies, but just lots of miscarriages, more than you would expect for a young couple. And their story just sort of seemed like it. And I was like, guys, I know you said that you've done all the testing, but we really just should do a karyotype, even in preparing for IVF. Let's just make sure we're not missing anything. And sure enough, the husband had a balanced translocation. And I was mixed feelings when I got it. I was so happy to have an answer for them because that's one of the main reasons they came to ask me questions, but also just frustrated that this is something that could have been found sooner in their fertility journey. When I reached out to let them know, they sort of came back to me with mixed emotions because the wife said, Dr. Shahine, we just found out this morning that we had a positive pregnancy test. So here they are, naturally pregnant again, thinking about doing IVF, now found this issue with balanced translocation, and they were just full of mixed emotions. And I just tried to encourage them. You guys have had a baby before. It could happen. And I said, let's just stay in touch. A year later, I got a holiday card from this beautiful family of 4. So that pregnancy, that 12th pregnancy for this couple, resulted in their second live birth and beautiful child. And I will just never forget them and just really think that we can take away a few lessons from that. 3 lessons I can think of. Number 1, not everyone has to do IVF with chromosomal screening to have their family, even with a balanced translocation. Number 2, don't hesitate to get that 2nd, 3rd, 4th medical opinion when you are not finding answers. Somebody with just fresh eyes looking at it, one more time, sometimes can think of something in a new light. And number 3, lesson learned, don't give up hope. I love that story. That family still sends me holiday cards every year, and I just love sharing that story with you. I hope you enjoyed this episode and can take away some key information to ask your doctor about whether genetic screening is right for you on your fertility journey. Find this episode and all others at my website, drlorashahine.com. More educational content on YouTube, Instagram, TikTok. I just love teaching, and I want you to be able to find the answers you're looking for. Please send us an email to hello@drlorashahine.com. Share your own fertility story and topics that you'd love us to cover here. Thank you to my producer, Shannon Perry, and her team at Audiotocracy. This is your host, Dr. Lora Shahine. See you next week, and until then, wishing you love, luck, and pineapples.